Everybody, welcome back to Around the Emirates podcast with Sara Mousa, where I speak to guests from across Syria about topics you want to hear about. Today, I am delighted to be joined by the legendary Dr. Katrin Jahn. Hi, Dr. Katrin.
Hi, Sarah. Lovely to be here.
Lovely to have you here. So, Dr. Katrin does something which I'm sure a lot of you guys have not come across before, and it's super cool. She is a veterinary psychiatrist. Please tell me your story and what that even means.
Yeah, so I've been a veterinarian for over 25 years. And as part of that journey, I really realized that we as a profession are great at taking care of the physical health of our pets, but we haven't traditionally been so great at taking care of their mental and emotional health. And when I opened my own practice here in the UAE, gosh, 16 years ago now, I became kind of increasingly aware that patients coming into the practice were feeling anxious, fearful, stressed. We were seeing more and more fearful patients, something that kind of increased as well, sort of during the COVID pandemic. And so I decided to do something about it. So in 2019, I started a residency in veterinary behavior medicine, also known as veterinary psychiatry, which is a pretty intensive training program, which I did through both the European and the American colleges of veterinary behavior medicine. So I had to see like 400 clinical cases. I had to do my own original research, write case reports, and do a whole bunch of other things. And then finally, last year for the American College and early this year for the European College, I sat like two very grueling, extensive exams and passed them both. And so now I am a double board certified specialist in veterinary behavior medicine.
That is amazing. Congratulations. I believe you're one of only, 10 people worldwide with your certification? That's crazy.
Yeah, so I think with double certification, so there are a kind of over 100 in the American college and probably about 40 or 50 in the European college. But of those of us that have the double certification, I think we're about 8 or 9 globally. So yeah, quite a small number.
What a role model you are. And to come into something that is so specific, so difficult, so challenging. What kind of experiences came with that and how did you overcome these challenges?
Yeah, so I think a number. Obviously, not so most residencies are done based at a university setting. So remaining in my own private practice was really important to me. So being able to still be here, see my patients, run my clinic. So we had to kind of design for ourselves a what we call like a non-traditional residency program. So you design the program yourself and you have to fulfill all the different things that come with that. And it takes a little bit longer than normal residencies. And then, of course, COVID happened right in the middle of that. So that put things back by about a year. So there have been a number of challenges, but also introducing the topic into the region has been quite interesting. So I'm the only person that does veterinary behavior medicine in the whole of sort of the Middle East region. And so actually just raising awareness that pets who are also sentient beings can have emotional health disorders, that they suffer from fears, from anxieties, from phobias, from traumatic experiences, things that they experience in puppyhood or kittenhood. So just raising the awareness around that has been quite a challenge, but it's also been hugely satisfying. And as is typical for the UAE, it's been such an open and welcoming space to introduce a new concept like this. So obviously being a practice owner here for the last 16 years, I'm very familiar with the UAE and its many opportunities, and it's been the same for bringing a new service into the region as well. So there have been challenges, but it's actually also been a real pleasure to bring something new to the region.
I love your passion for what you do. I can tell that you really speak from the heart and you bring top of mind something that none of us really consider. Like obviously, we do treat animals with respect, but to consider the fact that animals, well, most of us don't know how to communicate with animals, right? We don't understand how to make that engagement. So to understand that there are many more deeper layers when it comes to animals and their feelings. I mean, they're just like us, right? At the end of the day, most of our DNA is shared, especially when it comes to certain types of animals. So it's so cool that you've been able to raise awareness for this. And I'm curious. I mean, of course, with your vast experience and your incredible accomplishments, what kind of stories or experiences must have come along with that?
Gosh, so many. I mean, if I kind of take it back sort of to my early childhood, one of the experiences that I've kind of found out has shaped me was when I was 4, I was actually admitted to hospital for a really routine procedure, which was a little umbilical hernia repair. And this was in the sort of late 1970s. And at that time, my parents weren't allowed to stay with me in the hospital, and it was quite a frightening experience for a 4-year-old girl. And to this day, I can still remember that experience. I can remember what that ward looked like. I can remember, who the people were that took care of me there. And it wasn't a nice experience. And I think when I opened my own practice, some of those memories came back, and just seeing um, dogs and cats being separated from their family, from their caregivers, coming into a clinic, maybe staying in the hospital because they're sick, not really understanding why they're there, being quite fearful of the different environment and the handling, all that sort of thing. And as you mentioned, Sarah, the fact that they are non-verbal communicators, so having to be really clued up about their body language communications. So I think that one of that early experience in my life really sort of helped shape how I wanted to practice and how I wanted to treat my patients in the clinic. So I think that's definitely one of the big experiences. But I think the other massive experience for me is the relationships that I've built with pet owners through supporting them through their struggles, because living with a pet with behavioral challenges is not easy and can bring up a lot of emotions in oneself and can cause family conflict, within the family. Some family members are more maybe empathetic or understanding to the pet's behavior. Other family members really struggle to deal with it. And that's been a really big experience. So those big relationships that I've built over time, very trust-based relationships, and helping to navigate people through some of these sort of challenging situations. So yeah, there've been a lot of stories. And I think, each individual patient teaches you something. So there are so many, I mean, I've seen over almost 400 patients, sorry, almost 500 patients now. And each patient teaches you something, whether it's something about their communication or their body language or their specific needs, or how they as an individual deal with something, or how that sort of pet parent dynamic individually dealt with a situation, or what some of the individual struggles were. So I'm eternally grateful for my patients and the caregivers that put the trust in me, and where I've been able to support them and make a difference to their lives. So yeah, it's been a journey.
That is so beautiful. I love how you almost brought together two communities. You brought together animals and you brought together people. Like, it's really
Yeah.
interesting to hear that you haven't just bonded with the animals and been able to understand the animals' feelings and thoughts, but the fact that you've been able to almost create that bond or even enhance the bond between the pet parents and the pets themselves. And the fact that you are also so open to learning and so open to understanding new ways of doing what you do, even as a double board certified expert, you are still somebody who is open to understanding more about the cultures and the different animals and the different ways that they think. And I'm curious, what is your favorite thing about what you do?
Oh my goodness, there are so many. So as a veterinary psychiatrist, one of the things that we are able to do is actually use medications to help our pets. So very similar to human psychiatry, we would use medications that help to alleviate fear, anxiety, and stress. And learning about those medications, because they weren't medications that we necessarily learnt about in vet school. And it's a pretty new field, the whole idea of veterinary psychopharmacology. So that is one of my favorite things, because obviously you have to be extremely kind of circumspect about choosing the right patient, making a right diagnosis, making sure they don't have any other physical health issues going on. But when that medication works well for that patient, it is such a game changer. And seeing those transformations and how a pet goes from really worried and anxious and hypervigilant and stressed to playful and joyful and goofy and silly and more interactive, and all those things is just a delight to watch. So I'd say that's one thing. But the other thing I think is going back to those relationships, and as you rightly said, you have to treat the entity as a whole, because if you don't bring the pet parents on board with you, they are eventually the ones that are going to be implementing what you recommend, and they're the ones that are going to be making the changes at home and maybe doing the training if there's training to be done. So that, and then I think the other part is educating other veterinary professionals. So that starts with my team at my clinic. So I have a team of almost 25 people. So kind of having that shared vision together on how we would like to treat our patients in the clinic. And then also educating other vets on veterinary psychiatry and what they can do in their practices and what they can do if a patient like that presents to them. So I'd say those are my top three things that I love, but there's like a lot more than that as well.
Guys, I totally did not tell her I was going to ask that question, so that's totally off the cuff right there. That's so cool. But thank you for sharing that. And this brings me to my final question, Dr. Katrin. I really enjoyed our conversation so far, and you have already touched on this a little bit, but if you had one final word of advice for all listeners on this episode, what would it be?
See pets as sentient beings. I think that would be my first thing. Understand that they have emotions, that they have positive and negative emotions, and that they're important for their well-being, their welfare. So just understanding that, being open to that, being open to learning about their body language, their communication, their species-specific needs. But also, if you find yourself struggling with your pet's behavior, reach out to a professional. There's a lot of help out there. So there's a lot of advice in places that maybe isn't correct. So be mindful of where you look for the information that you get, but reach out to a professional. There's so much help out there now. And there are so many things that can be done. I think a lot of pet parents feel a little bit despondent or hopeless if they're living with a pet with behavior problems and they don't quite know what to do. So come and seek me out or find somebody like myself to help you. And yeah, there's always a solution to most problems.
And where can people find you and come visit you for your services?
So either at the German Veterinary Clinic in Abu Dhabi, so that's my bricks and mortar business, but I also have an online business called Trinity Veterinary Behaviour, which is an online hub where pet parents can get advice, information, book consultations. There's also educational material on there for vets and other pet care professionals. And yeah, and I'm also on social media with at Trinity Vet Behaviour, and also a great Facebook group, the Pet Behaviour Community. And I have a podcast, the Pet Behaviour Chat. So lots of places.
Nice. That last one was my favorite, FYI. But
The podcast.
But thank you so much, Dr. Katrin, for your time today. I learned so much about animal behavior and animal kind of emotional and mental state of mind as well. So thank you for sharing your insights today.
My pleasure. Thank you so much.